Good morning, everyone, and thank you for joining us on this webinar. I'm Gary Harbison with the Coalition. I just wanted to say welcome, and I'm going to turn it over to Jessica Emmerich.
Thank you. Yes, I'm Jessica Emmerich. Good morning to you. I'm going to go ahead and share my screen. It is 9 o'clock, so we are going to go ahead and try to get started in the interest of time. Okay, so today's webinar is about Medicaid rates and challenges to increase access and provider participation. We'll be starting in just a couple minutes, but while we wait for our final attendees to join, I'm going to cover a few housekeeping items. During the webinar, attendees are muted, but you can submit your questions in the Q&A box. There's an option at the bottom of your screen that says Q&A. Please enter any questions there throughout the presentation, and then we will answer all questions at the end. This webinar is being recorded, and you will be able to find the recording on the Coalition website after the presentation. At the end of the presentation, I'm going to put a survey link in the chat box. This link is also going to be sent out by email following the webinar. Please take time to complete the survey. Your feedback helps us to continue to provide webinars and trainings that are beneficial to you. So I am Jessica Emmerich. I'm the Dental Medicaid Facilitator with the Missouri Coalition for Oral Health. With the help of the Missouri Dental Association and HealthNet, we've been working with dental providers to increase Medicaid participation. This webinar is going to tell you more about our work and the Missouri Coalition for Oral Health model that was used to achieve our success. Today, we also have Amanda Ferrendorf from HealthNet with us, who will be sharing some data that supports our work and shows the impact our efforts have had on the state of Missouri. The Missouri Coalition for Oral Health is a 501c3 advocacy organization made of a statewide network of oral health advocates. Our mission is to improve oral health for all Missourians, and our vision is oral health for all Missourians. The coalition has been successful in working towards our mission as a result of several past accomplishments. We've made many great strides in promoting teledentistry and supporting community water fluoridation. As mentioned, our coalition is an organization made up of statewide oral health advocates. These are just a few of our partners. We take a lot of pride in having many different voices in the conversation when advocating for oral health needs of all Missourians. To give you a little background and information about Missouri, Missouri is a mostly rural state, but does have a few urban areas. Missouri has 8 bordering states, and providers in these states are able to enroll with Medicaid as in-state providers. Roughly 20% of Missouri's population is enrolled with the Medicaid services. Missouri Medicaid is also referred to as HealthNet. Dental providers often refer to it as traditional Medicaid. There are 2 dental benefits in Missouri. We have comprehensive coverage for children, pregnant women, and nursing home residents. And then we have limited dental benefits for the general adult population. Missouri Medicaid provides services through 3 managed care plans along with HealthNet. The 3 managed care plans are Healthy Blue, United Healthcare, and Home State Health. This map shows the percentage of each county population that is enrolled with Medicaid. So as you can see, as you go farther south, it becomes a more rural area. We see a higher percentage of Medicaid participants for that population in that area. This map was provided by the Missouri Foundation for Health and their Missouri Medicaid Basics document that they put out each year. So in 2022, the coalition was successful in having the dental Medicaid rates increase from roughly 38.5% to 80% usual and customary rates. This rate increase was significant and brought the rates up to a commercial level, making Medicaid comparable to other PPO providers. To put this rate increase in perspective, I have this chart that shows the rate an office would typically charge, the rate a PPO would reimburse, the old Medicaid rate, and the new Medicaid rate. The office fees and PPO rates were collected from several different practices and then averaged together. So none of these numbers are exact numbers, these are averages. In some cases, you can see the new Medicaid rates are even higher than the PPO rates. With the new rates, a dental practice can be profitable by seeing Medicaid patients. I won't read through all these, but I will point out a few commonly used. such as D0330 for a piano. Office typically charges around $128. PPOs reimburse around $81. The old Medicaid rate was $36 and some change. That is now around $104. So that's a significant increase for a pretty routine service. I'll also point out the pro fees. This is your cleaning that you get every 6 months. This is something that all dental practices do for the most part. So here's their average rate, the average reimbursement rate. The old rates, they were only getting between $20 and $30 for those cleanings. Now the rate has increased to $62 and $85. So as you take it to your time to look through these rates, you can really see how significant this rate increase was. So while the rate increase was very significant, the rates alone were not enough to get dental providers on board. When the new rates were implemented, we did not see a spike in provider enrollment. The rates were only one piece of the puzzle. Practices with no Medicaid experience didn't even bother to look at the new rates because the rates had been so low in the past. With the pandemic, the dental force was impacted. Dental providers were already busy in booking dental appointments more than 6 months out. Another barrier was Missouri's split dental system, where we have one set of dental providers for the middle class and socioeconomically advantaged, and another set for everyone else. There was a major Medicaid stereotype depending on the region, economical status of people in Missouri, where they either had ready access, limited access, or no access at all to dental service. These barriers led us to our next question, which was how do we get around, through, over, under that wall that divides the dental care system? The coalition knew that more needed to be done, so we reached out to two essential partners that were already heavily impacted by the rate increase. We worked with the Missouri Dental Association and HealthNet. After finding our partners, we needed funding. The coalition was able to secure funding from the Missouri Foundation for Health, Health Forward Foundation, and Delta Dental of Missouri to increase access to care by increasing dental provider participation in Medicaid. And those became our core objectives. Increase the number of Missourians receiving dental care by increasing the number of dental providers offering Medicaid services. The goal and full circle moment of this work is to increase Medicaid dental provider participation, which increases access to care, which increases the number of children ready to grow and learn, which increases the number of adults ready to contribute to their communities. The goal is that all Missourians would have access to a dental home where they can receive that regular preventative services and reduce the need for more extensive dental services and potential ER visits. So the Missouri Coalition for Oral Health Model is made up of 3 components. The Dental Medicaid Facilitator. This is my role. We needed a full-time person that would be able to work directly with dental practices and providers to answer the questions, assist with enrollment, and help navigate resources. Through this role and working directly with providers, we were able to identify barriers and challenges that dental providers were encountering and were keeping them from enrolling with Medicaid. While the Dental Medicaid Facilitator works on this project full-time, all coalition staff assist with this work and were part of the success. Our partners were mentioned earlier, Missouri Dental Association and HealthNet. Together, we were able to address concerns, modify policy, and overall make sure that processes were working well for dental providers. We meet every 2 weeks to talk about what we are encountering, challenges that providers are facing, and how we can help address them. Through this collaboration, we've been able to create more dental-specific resources and help providers and their teams navigate the Medicaid processes. The third part of this model is our targeted media campaign. The coalition has worked with High Five Communications to develop and deploy information to dental providers and students in Missouri. As mentioned, many dental providers didn't even know about the rate increase. Our media team used online banner ads, social media, email, and traditional mailings to reach providers where they were. We were able to use the media campaign to provide information on recent changes and direct providers to the Dental Medicaid Facilitator to help them navigate resources. We wanted to use the media campaign to tell providers about the rate increase, show that the new rates were now profitable, and then address the myths about Medicaid and the Medicaid participants. We knew we needed to keep the message simple and direct them to accurate and consistent support resources. As we began building the media campaign, we wanted to know more about the current Medicaid provider perspective. To help us identify common myths or barriers that were preventing dental providers from enrolling with Medicaid, we created a simple survey to gauge the provider's current experience and thoughts about Medicaid. This survey was sent out by our media team to all dental providers and dental students in Missouri. Responses to the survey were used to identify the myths we needed to address, shape the media campaign materials, develop webinars, and overall guide the coalition advocacy efforts. One of the biggest takeaways was that providers listened to other providers. The first phase of the media campaign was to raise awareness about Medicaid and the Medicaid population. Many providers didn't know that adults could have Medicaid coverage. We wanted to use that initial phase of the campaign to let providers know who the Medicaid participants are. These are two examples of the ads that were placed on social media and also used as banner ads. So using the feedback from providers and the survey responses, we were able to quickly learn about the most predominant challenges providers were facing, along with several myths that we needed to address. We learned very quickly that providers are busy, concerned about being overrun with Medicaid, and they thought the enrollment process was slow. And the managed care process for credentialing was slow, those were true. Providers needed help navigating the processes and expectations of Medicaid. Those are things that were very obvious with those initial survey responses. We also had some myths come back on those surveys. Some of the myths were that Missouri Medicaid did several audits for no reason, and they were always very severe. Medicaid is unreliable. Enrollment means you have to take any Medicaid patient who walks in your door, and that those Medicaid participants are going to no-show at a high rate, and that there's nothing providers can do about that. Those were the things that we were very aware of with the first responses from the survey. As we continued to talk with providers, we also learned that the lack of specialty providers was a barrier for general practice providers. They had concerns about not having specialty providers to refer their patients to. The sedation and extraction rates were not increased in 2022. We also learned that this was a barrier, especially for getting those specialty providers enrolled. And we wanted to establish a dental home for all participants in Missouri, but that periodic exam, that DO-120 that's billable every 6 months, was not included in the limited adult dental benefit. So the second phase of the media campaign addressed the Medicaid myths. Here again, we have two examples of the ads that were developed to address common concerns and myths from providers. So over time, as we worked with the providers and collaborated with our partners, the Missouri Dental Association and HealthNet, we were able to achieve some policy changes to improve the Medicaid process. We were able to work with Missouri Medicaid Audit and Compliance and HealthNet to work on the enrollment credentialing and billing information. We were able to put together some new resources that were dental specific that helped walk providers through the expectations. The dental sedation and extraction rates, we were able to increase to that 80% UCR in July of 2024. Again, there was concern about audits, so we were able to do a recorded webinar with the Missouri Medicaid Audit and Compliance Director, where he went over what they're looking for, what would trigger an audit, and what providers need to know to be prepared. And we were also able to expand silver diamond fluoride coverage. Is now available to all participants with comprehensive coverage, which would be our children, pregnant women, nursing home residents, where before it was only available to young children. We were able to have that periodic exam that DO 120 added to the limited adult benefit to help them establish their dental home. We were able to expand the postpartum comprehensive dental benefits from 90 days to 1 year. The need for specialty dental providers is still there. We are still working with several specialty providers, but we are making progress with getting them on board. And now the surprising thing is that we now encourage providers to talk with other providers. In the beginning, when we did the initial survey, there was a lot of negative stereotypes about Medicaid where we were hesitant to ask providers to talk with other providers. But now we have kind of changed that message, and eventually this has become part of our media campaign. So as we mentioned, providers listen to other providers. So we were able to conduct interviews with dental providers who were both new to Medicaid and experienced with Medicaid. This gave providers the opportunity to share their experience and for peers to hear what we had been trying to tell them. So here's an example of the interviews. This ad is only a few seconds, and we do have a longer video of this provider's interview available on our website. So we would use this clip in an ad as a banner ad or social media, and then we would add a link to the longer video and any supportive resources. And then all the ads that we use on social media and banner ads link back to the Missouri Coalition for Oral Health website. So I'm going to play this first interview for you. This gentleman interviewed is Dr. Quigless. He was new to Medicaid. He saw some of our materials in the beginning of the media campaign. We helped him through the enrollment process and helped him implement Medicaid into his practice. So I'm going to share just a clip of this for you.
We probably see at least 50% Medicaid patients. We love the patients and the patients love us. A lot of people are grateful just to get treatment, that they can smile again. The biggest plus is knowing that you are helping people and that they appreciate it. Everybody that I came across was very helpful. There's something to be said about knowing exactly what you're going to get and when you're going to get it for the work that you've done.
So again, these interviews really made a big difference in our outreach with new providers. Hearing it from their peers was really kind of a game changer for them. They had a lot more faith in their peers and what they were telling them, even though it was consistent with what we were telling them. We also have another quote here from another dental provider. This dental provider has been enrolled with Medicaid for several years before the rates increased. They said Medicaid requirements are consistent across the board with fee-for-service and managed care plans, making it easier to deal with than multiple insurance companies. So again, it was great to have that feedback from providers. So once we can direct providers to the Missouri Coalition for Oral Health website, they can find news and blogs about Medicaid. They can find our previously recorded webinars, provider resources and information, and they have an opportunity to contact me directly. By pointing providers to one site that had everything they needed, all their resources, all the information, it just became a lot easier for providers to know where to start looking when they had questions about Medicaid. So with that, I'm going to hand this over to Amanda Ferendorf with HealthNet to tell you about the impact this work has had on the state of Missouri.
Sorry about the delay there. It took me a minute to switch the slides. Okay, so I wanted to kind of go over a timeline of what happened and kind of how we got here today. So in the beginning, in June of 24, we began the collaboration with the Coalition for Oral Health and the Missouri Dental Association. So that was the beginning of the whole process because we knew that the rate change was coming. So MoHealthNet implemented a significant rate increase aligned with our dental rates, aligned with many of the rates of commercial insurances, which I know that Jesse had mentioned. We realized that that was an opportunity for us to get more dental providers so that we can serve more of our Medicaid patients. The Missouri Coalition of Oral Health established a dental Medicaid facilitator to concentrate on attracting new providers, assist MoHealthNet with enrollment, troubleshooting processes, and barriers associated with working with MoHealthNet, and decrease provider abrasion. So through this process, like Jesse had mentioned, we identified several different things that we could do better as an agency, and together we worked together to address some of those things. Like enrollment was one big part of it. There's hiccups with enrollment. We created a enrollment guide to help providers through that process a little bit easier. We know things aren't perfect, but together we have been addressing a lot of those issues. In April of 23, the Coalition launched the media campaign to address the myths, provider resources, and created opportunities for providers to communicate their needs with the Coalition as well as MoHealthNet. So her role was essential in helping us to have the time to address a lot of these things, and she was communicating with our providers and helping with the enrollment process. So in July of 24, we continued to make progress. In the beginning, the extractions weren't increased at that time. Dental anesthesia was increased, but we increased it more. We added periodic exams to the limited benefit and increased access to SDF. Okay, so a lot of providers, you guys want to know the impact. So as of today, there's a net increase of 351 enrolled dental providers. Over this process, we've enrolled 761 new dental providers between fiscal year 22 and the current state fiscal year of 26. So we just started that, right? So it's at the very beginning, but I wanted to go ahead and include the data and show that we are continuing to increase our provider enrollment. The number of performing providers increased by 183 between state fiscal year 22 and 24. I'm pending the 2025 claims data. There's a lag time so that they have time to get those claims in, so they're accounted for. So I'll have more participant data and performing data so that we can really look at that here in the future. So currently we have 1,389 dental providers that are enrolled as Medicaid providers. And as you can tell, there was a steady trend of an increase in providers over the time. So something I wanted to make sure to break down, since a lot of you kind of want to know the specific numbers, what all these different things mean. So if you can see the column that says gained dental providers, these individuals were previously enrolled with MoHealthNet and then decided to re-enroll. So there were several, but if you look to see where it says lost dental providers, that's when they had left MoHealthNet. So there's a huge chunk of providers here, 226, but we also have to understand this is when we started looking at all these things, and the providers that weren't providing services, they were no longer enrolled. So like we cleaned this up a little bit. So that's why there's that huge drop in providers. So it's important to kind of understand what was happening during that time. And then there's still a loss in providers, but not as significant. So the new provider column those are providers that have never been enrolled with Medicaid, period. So we were able to attract over 700 providers during this process over this 4-year period. And that is really important. So it balances out, right? And that's why when we look at, okay, there were 700 new providers, but the net increase was like 300 and something, but still it's progress. So the impact, oopsie, sorry. So in the big picture, we wanted to look at the fact that we have increased the number of licensed dentists enrolled in the Medicaid program. So from 2022 to 2025, we have increased from 34% to 43% of licensed dentists in the state of Missouri who have decided to enroll with the state Medicaid program. What is the impact on our participants? The increased number of participants were split evenly between our adults and children. So we should show that we increased access to care, not only to our children, but to our adult population as well. The public health emergency unwind happened in fiscal year 24, which reduced the overall number of MoHealthNet participants. So you can see there's a significant drop in enrolled participants, but we still increased the number of individuals we saw. So we increased access over that period of time by 81,000 participants that have accessed care that they weren't previously accessing care. Now, I don't have fiscal year 25's data yet, but we will be getting that shortly. All right, so we did mention in 2024 that we increased the rates for extractions and dental anesthesia, added periodic exams to the limited benefit, and increased access to SDF. And some of the rate increases provided, these are just some of the rate increases provided below. Providers expressed the need for this to be changed, which was really important because, you know, it was great that we were increasing enrolled providers, but the specialty providers, you know, once they started getting routine care and they went to the dentist, then we realized, hey, there's a lot of things that they need, but we didn't increase that when we increased those rates. So we wanted to make sure to address that. And that was one of the things we did through the partnership with the coalition, the Missouri Dental Association. So there were other observations that we found when we were looking at this, the access to ambulatory surgical centers and outpatient hospitals. So dental providers expressed concerns about the limited access to the ASCs and outpatient hospital facilities needed to perform the procedures requiring sedation. Our ASCs and our outpatient facilities were citing low reimbursement. So MoHealthNet looked at the claims data and determined that many of those facilities were not billing correctly. We kind of have a unique way of submitting claims for services that were provided in an ASC or outpatient hospital. So we scheduled 2 webinars to actually work with the hospitals and the ambulatory surgical centers to explain how they can submit their claims to get the most out of it, because that turned a lot of providers off. So part of this process was getting people in for period, you know, just regular routine care, finding the needs that they had, and actually being able to follow through with treatment. This is still a barrier. However, it's gotten much better through this process. So I just wanted to share some of these numbers. And Jesse, I think I'm going to turn it back over to you.
Sure. Oh, you have to stop sharing.
Yeah, sorry.
That's okay.
There you go.
Thank you. Okay, so as you can see from MoHealthNet's data, we are seeing a steady increase, a steady trend, seeing the numbers of providers and participants accessing care increase over the years. We're looking forward to continuing to work with dental providers and their teams to continue to identify barriers and provide assistance with navigating Medicaid. And we anticipate that the number of dental providers enrolled with Medicaid and the number of participants accessing care will continue to increase. Let's see. So Amanda mentioned that we are still waiting on the fiscal year 25 data. If you guys are interested in learning more about that, then I would like to invite you to the 2026 Missouri Oral Health Policy Conference, where we do an update on our Medicaid work each year. It's a great opportunity to learn more about the coalition and some of the other projects that we are working on, and just collaborate with a network of great advocates across the state and several different opportunities. So this is contact information for Amanda and I. We are happy to talk with anyone about this work that we have done, share more about the Missouri Coalition for Oral Health model, how we got here. So feel free to reach out to us if you have any questions or would like to discuss this in a little more detail. At this point, I would like to offer to let you guys put any questions you may have in the Q&A box. We have plenty of time remaining. I want to encourage any discussion and questions you may have so that we can make this most beneficial presentation for you and see what else we can provide to help you guys learn about this model. Okay, so in our Q&A, we are already getting a few questions. One this first question, I believe, is from a dental practice that says they do have a lot of Medicaid patients no-show. We're not allowed to charge them a no-show fee. What are the solutions for providers? So this is a really good question. It's something, it's one of those myths that we encountered very early on, that the Medicaid patients no-show. And I'm not going to tell you that they're all going to show up. I think that when we have looked at dental practices, the Medicaid no-show rate is comparable to, private pay or PPOs. It's similar. I can't say one is more than the other. And do keep in mind these Medicaid participants, they're on Medicaid because they are facing some challenges. So what we encourage providers to do when this happens is to communicate with those participants and maybe identify, was it a work issue? Is it transportation? Is there anything that we can do? Maybe schedule them a different time, just something we need to know where we could work with them to resolve it. So that's kind of your first option as a dental provider, as a dental practice. And I feel like most practices would do that with any no-show patients. But I always want to throw that out there as kind of your first course of action. But if it continues, your dental practice, you can set any limitations that you need. So you can set a policy that says, two no-shows in 6 months, and we're going to dismiss this patient. So any practice policies that you would have in place for all your other patients can apply to your Medicaid patients as well. We don't expect them to have special treatment. We don't expect them to be outside of your policy requirements. So I would suggest that the practice would implement some sort of a policy to decide, this is what we can accept, and after this, the patient would be dismissed. And we hope that you would maybe be able to refer them to someone else or let them know what the issue was. But you are in control of your practice and you can set any necessary policies that you need to make it workable for your practice. We know that those no-shows do cost the practices money, so we want you to be in control of your practice and be able to mediate that however you need. Okay, so another question. Will there be an increase to covered services like crown dentures, bridges for the limited policies? We see the greatest people who really need these services, but they do not have the money to pay since they are not covered. And I agree. So we know that adults have that limited coverage, which means that they receive a lot of preventative services. They can receive fillings, they can get extractions. So they do get some services, but it is limited. Crowns are typically not covered. Dentures, bridges are not covered. So we would like to see some of those additional services added to the limited adult benefit. It is something that we're always talking about and always looking for the opportunity to expand those limited dental services. It takes time. It always takes time. What I will tell you is that for those services that are not covered by Medicaid, practices can work out a payment agreement with the participants at that point. I know a lot of practices offer a sliding scale or a discounted rate for non-covered services, or they can set up payment plans or whatever they need to make that workable for the participant. Otherwise, right now we're making progress, but progress takes time. So it's something we're aware of, and we appreciate that feedback from providers. That helps us know what else we need to talk with MoHealthNet about, what else we need to benefit both the Medicaid participants and providers. Okay, here's another one. It says, we're still having credentialing issues with one of the managed care plans. Why does it take 6 months or more to get approved? So we know that there are still barriers to the credentialing plan, and unfortunately with the managed care plans, we cannot get as involved with their credentialing processes because they are outside organizations. So we can't get as involved with those plans, but we can help communicate with them. We can help make sure that they know that these delays are causing barriers for providers. And I will say that we are working towards, we're asking for, we've been in discussion about trying to combine the application process for MoHealthNet and the 3 managed care plans into one application to help address the barrier of how long it takes to credential and enroll. So it is something that we are talking about, and we are talking with both MoHealthNet and the managed care plans about, but it is in the works. In the meantime, if you encounter those issues, please reach out to me. Let me know. That is part of my job, is to help facilitate those conversations and connect the providers with the plans to help resolve the issues. So I'm happy to work with you in the managed care plans to try to resolve that for you and see if there's a delay because of missing documents or because they're waiting on something else. So just to help be that voice of communication and kind of moderate that situation.
Would you like me to take a stab at that, Jesse? That next
Sure,
question.
sure, yeah.
So the question from Allison is, how are you anticipating the federal funding changes will affect MoHealthNet? Well, the short answer is we don't actually know. We do know a couple of things, and this is more opinion at this point. So I'll own it as my opinion. The federal requirements change so that there's more frequent requirements for redeterminations for Medicaid eligibility. And there's also some job requirements or effort to, gain work. Both of those things will, I think, result in some administrative loss of Medicaid coverage. Um, we don't know the depth of that until we get into it and see how it actually operates. Beyond that, it's unclear purely on the budgetary side exactly what is going to happen with the Missouri budget related to Medicaid. Um, it's just unclear at this point, so stay tuned. We think there will be some impact, and there also are some challenges with the budget, the state budget, just as it is. But we don't know exactly what the state will feel that they need to do, or how they'll respond to any of that. So it's a great question, but we don't have a good answer at this point.
Sure. And I will add on to that, that while we are waiting to see what exactly is going to happen, I encourage providers to continue to verify eligibility and to monitor eligibility, make sure that you are doing your due diligence to make sure that you get paid for those services, because we know that eligibility changes could be coming. So it's great to get in that good practice of verifying the eligibility on the data service. And then I would also like to add on that whatever changes do come, that is still part of our role, and we plan to help providers navigate any changes and provide consistent and accurate information to help kind of shed some light on what may come. So we will be here to help relay information and make sure you're getting accurate information and help providers know how to navigate any changes that do come. So it is something we are aware of and keeping an eye on, and we will do our best to support our providers through any changes. Okay, there's a question that says it may be helpful if we could streamline the process of providing transportation for these families with Uber vouchers, etc. Open to any ideas. So I agree. I think MoHealthNet is always looking for opportunities to improve transportation. Amanda, do you have anything you can share about available transportation for Medicaid participants and how they could kind of help participants with that barrier?
Well, we have non-emergency transportation through our transportation broker, MTM. We realize there are some challenges with that, but that is a service that's available for our Medicaid participants. Another thing a lot of providers don't know about and participants don't know about, there's mileage reimbursement. So like say grandma can take them, but we know it's a barrier and it's costly for her or a neighbor. The participant can submit for mileage reimbursement through the MTM app online. If they want more information about that, feel free to reach out to me and I can give you more information about that process. And Dr. Dean, I know that you're in a metro area, like I think Independence. A lot of times there is public transit that's available. And maybe you can maybe coordinate with some, you know, some people in the area, like, because like the more metro areas, the more opportunities there are for transportation. So together in a community setting, you might be able to find some help with that. But one thing I like to talk about is the mileage reimbursement. That could be helpful even if they can't get the broker to come and that's not what they want to do, there is that other option.
Thank you. So yeah, and I'll also put in there that these options are available through HealthNet. Sometimes participants have trouble finding this information. So if we can make our providers aware of what opportunities there are for participants to kind of address that transportation barrier, we really appreciate our providers helping to share that information with participants. If you are identifying that, you know, we're having some no-shows or some late shows because of transportation, if you have that information where you are willing to share with them, that helps everyone in the picture. So we appreciate that and are happy to provide that information. All right, can you work on a single application and improve the process for HealthNet and managed care? It's a very long process for one of the managed care plans and participants ultimately have to wait. So yes, as I mentioned earlier, it is something that we have been talking with HealthNet about. We're talking with the managed care plans about. I can't say for sure that it's coming in a certain date. It is something that we know is an issue. And that is one of our ideas to solve that problem is to combine it all into one to relieve some of that administrative burden from dental providers. We know that patients ultimately have to wait, but we also have dental providers who are willing to join a practice, but they have to wait so long before they can get on the books to actually start seeing patients. So we know that that's a barrier, and it is one thing that we are actively working with HealthNet and Missouri Medicaid and Compliance on resolving. So more to come on that. Keep an eye. Once we have any updates or changes on that, we'll be sure to let everyone know. Is it possible to have better collaboration for coverage between managed care plans and HealthNet when it comes to orthodontics? So the managed care plans are required to follow HealthNet policy. So if HealthNet covers the service, the managed care plan should cover the service. So we should see good collaboration and consistent coverage between the managed care plans and HealthNet. If you are not seeing that, reach out to Amanda and I. We're happy to look into that and kind of see what's going on or what the issues may be and why those inconsistencies are there. But for the most part, if HealthNet covers the service, then the managed care plans should also be following that same rule, and they are also required to reimburse at least what HealthNet does for those services. So let Amanda and I know if there's some specific issues we can work with you on. A lot of times those cases are, we need to look at each case by case. I say we, I mean Amanda at the state because I am not with the state. Please do not send me claims information. Send that to Amanda. And we can kind of review those and help you work through those and make sure that providers are being paid fairly and consistently to make sure that you can provide the best care possible. So there have been a few times that we have had patients have coverage determined as inactive for up to a year after treatment. Are you aware why this happens and how to lessen the number of recouped payments from occurring? Amanda, do you have something you can share on that? They've had patients that have had coverage determined inactive for up to a year after treatment.
Yeah, and I'm assuming that's the managed care plans going back in and recouping payments. Sometimes it's something to do with our eligibility, something happening in our system, which then it kind of is a domino effect backwards, of course. In those situations, I think it would helpful for you to reach out to MoHealthNet just to see kind of what happened, because sometimes the eligibility files we send over to the managed care plans, there could be something that has been messed up or a segment was deleted. There's so many different people involved and systems involved in eligibility that just one little thing can throw things off. So if you're seeing a significant increase in these, you feel free to reach out to me. I can look at the eligibility, kind of see what happened. Maybe there was a problem and that we just need to fix it. We should honor eligibility that's checked on the data service. Now that would be EmoMed. If you looked at eligibility on EmoMed and it showed active and it showed all of that, I mean, that's something that kind of gives you a leg to stand on, right? So we can make sure and look at it to see what it said at the time. But I think case by case, I think you can reach out to me, give me the DCN, the dates of service, and I can look at it. And then we can reach out to the plan if we feel like it was an error. That was a long answer. Hopefully, let me know if you have more questions about that.
Yeah, thank you, Amanda. And I have put my contact information and Amanda's contact information in the chat, just in case you do have some specific questions you would like to talk with us about. Feel free to reach out. We're always happy to help. That's kind of our role, is to help resolve any of these issues and make things work better for you and make sure that we know what's going on. I've also included a link to that post-session survey. Like I mentioned at the beginning of the webinar, if you would please take just a few minutes to complete that survey for us. It just helps us to kind of evaluate, was this beneficial? Is there something we can do better? What else do we need to do to make these webinar experiences better for you? Okay, so as we still have plenty of time, please be sure to put any questions you may have in the Q&A. I'll go on with our next one, which was, how can we get in contact with you to help facilitate with these discussions with MoHealthNet? It took over 6 months to enroll as a provider, long process. Okay, so I will mention, because we're talking about enrollment, so MoHealthNet, Amanda's organization, MoHealthNet, they are not the ones processing your enrollment. So if you are having trouble with enrollment, you need to reach out to Missouri Medicaid Audit and Compliance or myself. So Missouri Medicaid Audit and Compliance, they're the ones who handle the provider enrollment. And if you email me, I can send you some contact information to get in touch with them. But typically MoHealthNet, they handle the claims, everything after you're enrolled. Missouri Medicaid Audit and Compliance, they're going to be the ones you're going to work with on the enrollment process. If you are seeing delays, which we know several state agencies are short-staffed. Enrollment applications, they take time. I will say that August is typically a busier time for them because that's when they renew ordering, prescribing, and referring provider applications. So I do understand that there are some instances where they are taking a little longer than we expect. But I've also seen times where they can get pushed through in 2 or 3 weeks, which is wonderful. So, but if you are seeing issues and it is taking 6 months is a very long time, reach out to me and let me know. I'm happy to help moderate and kind of facilitate some discussion there to see if it's a miscommunication, if they're missing documents, if something isn't filled out right. Missouri Medicaid and Audit Compliance, for those applications, they do have very strict requirements on how documents need to be filled out and what is needed for enrollment. So that's why we've provided a lot of new resources to help providers navigate that and know exactly what they are looking for on the applications. What are they looking for in each field of that application? So that way we can help providers enter accurate information, exactly what they're looking for up front. That way we can help expedite that process. If Missouri Medicaid Audit Compliance, if they receive all the correct documents, everything's filled out right, it really helps to expedite the enrollment. The ones that tend to lag are this form, the business organization structure form, is missing some information, or we didn't get all the supporting documents that we need for this provider. Those are typically what causes applications to take a little longer. So reach out to me, let me know. I'm happy to work with you and kind of help facilitate and make sure that we get everything we need in those applications so that we can kind of help speed that process along. We know that it causes some barriers for both providers and participants.
And there is an enrollment guide. I can try to find the link that breaks it down for all provider types, but dental, I believe dental is the one that spurred it all. So I'm going to try to find the link real quick to that resource, but it's on our provider information page. There's lots of different resources for that. We also realize that MAC is just one part of it. That's Missouri Medicaid Audit and Compliance. You have to enroll with us first, get the provider ID, and then you can enroll with the plans. At one point, we were, we were working pretty closely with the plans so that they would go ahead and let you start the enrollment process with them while you were going through MAC's process, and we might need to revisit that. I can reach out to them and kind of see what we can do. They're pretty easy to deal with. When I reach out to them and talk to them about stuff, they were very open to doing that. But that's been probably what, 6 months, Jesse, maybe a year.
Yeah.
And we can talk about it on the side, kind of how we want to deal with that. But I think it's just a little bit of communication if that's a 6-month problem. If it's MAC that's a 6-month problem, then, there's other things we can do to address that. And like Jesse said, contact her.
Yeah. Yeah. And I put a link in the chat. This takes you to the Missouri Coalition for Oral Health website, to the Medicaid page. This is where I mentioned in the presentation that we refer providers back to one page. It just makes things easier. So this is where on this page you can find my contact information, the news and blogs, all of our webinars. A lot of the resources we're talking about, that provider enrollment overguide is here. How to find a dentist in your area, how to determine eligibility. So all the resources we've created as a result of this work are on this page. This is also the page where you will find the recording of this webinar and any other webinars we have done. So it's kind of a good go-to spot if you're looking for something, but also feel free to reach out to Amanda or I, and we can point you in the right direction. Okay, next question is there a way we can find an oral surgeon or a periodontist in our area? We've had a hard time referring out to providers that take Medicaid. So I will say yes. I'm always happy to connect you with providers in your area if you want to reach out to me. You can also use the find a provider tool through HealthNet to kind of you have to put in your zip code, the type of provider you're looking for, and which managed care plan they have. And it'll bring up a list of providers in your area. I will say that participants also have the option to call the number on the back of their card, and the managed care plans have a coordinator who will help connect them with those specialty providers if needed. The managed care plans are a really good resource for finding a provider, especially with those managed care plans, because enrolled providers are not required to credential with all 3 plans. So you may find an oral surgeon that's enrolled with Healthy Blue, but they're not enrolled with Home State. So if you reach out to the number on the back of those cards, or the participant reaches out to those to their plan, they have a lot more resources to help connect them with a provider in their network. As the provider, you can also use the HealthNet search option or reach out to me, and I'm happy to try to help connect you with especially a provider in your area. But those are some really great options. And you can find links to that, how to find a provider, on that website that I just put in the chat. Also, if you know of an oral surgeon or periodontist that you would like to refer patients to, and they are not enrolled with Medicaid, let me know. Kind of start that conversation with them to see if they would consider accepting Medicaid. One thing that's been very beneficial for specialty providers is we've had several that have enrolled because a general practice has said, hey, I need someone to refer these patients to. So those specialty providers, they can enroll and say, hey, we're only going to take referrals from this provider. That way they don't have to be concerned about being overrun or having to take on too many. They can kind of just start their Medicaid experience by just taking those referrals from a provider that they know and they're already taking referrals from. So if you would help start that conversation, maybe give them my contact information, that helps us get more specialty providers on board. As we mentioned all through this, providers listen to other providers. If there are specialty providers in your area that you want to send your Medicaid patients to, you have to tell them about it. And you have to let them know, here, we have options now. You don't have to take everyone. The rates are better. There's people to help us navigate it. If you guys can help us start that conversation, it is such a game changer in helping get those providers on board. Because if I'm just calling them up and they don't know me, they're a lot more resistant to the information. But hearing it from someone they're already working with makes a big difference. So we appreciate having our providers help with spreading this information.
And Jesse, I think I could answer this next one. If
Sure.
you can go ahead and read it if you want.
Okay, the next one, I've had an issue for a long time with pre-authorization, secondary claims, etc. Basically, anything that requires mailing to you never seems to process. So when they're talking about mailing, so Mo HealthNet requires a few things to still be paper mailed. The managed care plans, you can submit documents through the portal. Amanda, I'll let you kind of take it from there, though.
Yeah. So Mo HealthNet, when there's something that requires a prior authorization, yes, it's mailed with all that documentation. It shouldn't take months. It shouldn't take that long, unless there's an issue. What I find is that some providers think that they just need to submit a PA for everything. Well, that doesn't get processed. It's like the black hole. You only submit a prior authorization for procedures that require one. So say there's several procedures that you're doing on that day, and it's just one of those things require a PA. That's the only thing you need to submit that on. Things that have a third party liability or primary payer, they don't need to be mailed in unless that particular procedure requires a PA or something. There's a way to enter all that information in the portal, and it takes seconds. Like it's just like any other claim that you put through EmoMed, and then you just add other payer at the bottom of that claim. And if you have questions about that, I'm happy to show you how to do that, as well as we have an education rep, Lee Gerloff, who is over the dental program with Mo HealthNet. She does webinars quarterly with dental providers. They're 2-hour webinars. It's interactive. You can ask questions the whole time, and we can talk to you about what things require a PA and what things don't, where you can go to figure that information out. We have lots of resources and lots of PowerPoints out there as well. I'm assuming that might be part of this process, is that you're sending stuff in that you don't have to, and don't send in paper claims, the secondaries, unless you absolutely have to. It's very simple. So I'm happy to help you with that.
Yeah, and I'll also add on there, if you are mailing things to Mo HealthNet, we recommend sending it certified mail. That way you get confirmation that it was received. We know our mail service, occasionally they could lose some things. Also, I want to point out that for those Mo HealthNet participants that you do need to mail, it's a very small percentage of the Medicaid population. So Mo HealthNet, they provide services for people with disabilities and nursing home residents. So adults, children, pregnant women, those are all going to be through the managed care plans. You can do those prior authorizations through the portal. It's just that smaller population that you do need to go through the paper process with Mo HealthNet. But if you have any questions about that, feel free to reach out to Mo HealthNet. I highly recommend attending one of their dental billing trainings with Lee Gerloff, where she walks through everything. She walks you through start to finish, the claim process, the eligibility process, everything you need to know. Attend those webinars as often as you can. Have your team attend those as well. It's very beneficial, and she's very good at answering any questions you have. And it gives you an opportunity to ask those questions instead of just assuming this is the process. It's going to take forever. It just is what it is. So keep that communication open, and feel free to reach out to me or Amanda, or attend one of the webinars with Lee and work with her directly. We're here to help you and help make sure that you can navigate those resources and that they make sense. So that kind of gets us through all of our questions. If there's any other questions, please feel free to go ahead and put those in there. Anything about the Missouri Coalition for Oral Health model, how we kind of shaped everything. If you have questions about the media campaign or the collaboration between Missouri Dental Association, Mo HealthNet, and the coalition, we're happy to answer any of those questions. So I'm going to give just another minute on those and remind you that there's a survey link in the chat. Amanda has posted a link to that enrollment guide and a link to the education and training page where you can sign up for those webinars we've been talking about. Okay, so there's another comment there in the Q&A. I'd like to have a discussion because we've done the trainings. I get that. Okay, so perfect. So please reach out to Amanda, myself, or Lee, and let us help you with this. Kind of walk you through it. Lee's done really great one-on-one trainings where she can work with a provider directly. Amanda has been in the dental world for so long. She knows all the ins and outs of HealthNet. So let's definitely set up a conversation where we can talk through this and make sure that we can make this work better for you.
And I
Well, I
just put
hope
my email again in the chat. So you guys can just send me an email. You'll get directly to me and then we'll talk about it because there could just be some hiccup and something we can smooth out pretty quickly. I'm sure I have an answer for you.
Well, I hope that you have found today's webinar beneficial. I hope that you have learned something or kind of had some ideas about where to go look for resources or kind of see what's new. As we mentioned in the beginning of all this work, providers just didn't know. They didn't know about the rate increase. They didn't know about the myths. So all of this work has been to collaborate and work together and bring those barriers and issues to the surface so that we can address them. It's very unique to have a state where the Missouri Medicaid plan is listening. They are listening to providers. They want your feedback. They want to know what's going on and how they can help. So I feel like that's a very unique situation. We have a wonderful collaboration here, and we want to use that. And we want to use it to improve access to oral health and to get more providers on board, to get more participants seen, so we can establish those dental homes and get everyone the routine care that they need. So with that, I'm going to go ahead and close out for today. We do have another webinar in 2 weeks about the recent changes to Missouri Medicaid and what they mean for dental providers. If you haven't signed up for that yet, we would encourage you to. Otherwise, we will go ahead and close out for today. Thank you all for attending, and please reach out to Amanda and I if you have any questions. We hope to have you involved with the coalition and see you at the 2026 Missouri Oral Health Policy Conference to learn more about this. Thanks.